Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Last week, a lady came to our clinic. She was diagnosed to have ectopic pregnancy. It was diagnosed by doing beta HCG test and ultrasound. We advised you don't have to do any surgery. You can go for medical management. That is, we can give some medicine, that is injection. Therefore, presence of ectopic pregnancy does not always mean that you have to do surgery. When you have to do surgery, if your ectopic pregnancy is ruptured, that is if you are having severe pain or bleeding, if your blood test shows very high level of beta HCG, in that case medicine will not work, you have to go for surgery. If ultrasound suggests that the sac size of the ectopic pregnancy is very high, it's very large size, or heartbeat of the baby is seen in ultrasound pregnancy in ultrasound, in that case medicine will not work, you have to go for surgery. Even when you have to go for surgery, remember we are no longer doing laparotomy, that is open operation we are not doing. We are not giving any large cut in the tummy. We are doing surgery for ectopic pregnancy by laparoscopy. That is making small hole inside the tummy, that is keyhole surgery, and then we can treat it. We only do open operation when laparoscopy is not possible. What we do by laparoscopy? If your fallopian tube is severely damaged, we have to take out the tube. That is, we have to remove the tube. But if it is mildly damaged, then we can take out the ectopic pregnancy and we can repair the rest of the tube and we can keep it inside the body. At the same time, during the operation, we have to check the other tube. That is, suppose you had ectopic pregnancy in the right tube, we are either removing the tube or we are repairing the tube. We have to check the left tube whether it is normal or not, because if the other tube is normal, then only you can conceive naturally. Now, when we are doing medical treatment, when we are giving medicine, if your ectopic pregnancy has not ruptured, if beta HCG is low, sac size, that is size of the ectopic pregnancy in ultrasound is smaller, and heartbeat of the baby is not seen in the ectopic pregnancy by ultrasound. In that case, we have to give medicine. We give one medicine, one injection called methotrexate. But remember, after giving methotrexate, 20% of women it may not work. That is, 80% cases methotrexate can resolve the ectopic pregnancy, but in 20% cases you may require surgery. And again, in 5% cases, after giving methotrexate, even after giving methotrexate injection, ectopic pregnancy may rupture and you may require emergency surgery. So what will you do? After taking methotrexate, you need to check beta HCG blood test frequently. If after 1 week you find that beta HCG is falling, you have to do the beta HCG once in a week at least until the result is negative. But as I have said, there is 5% chance that methotrexate, even after giving methotrexate, it may rupture. But don't worry, as I have said, in 80% cases, out of 100 women taking injection, 80% cases, you may not require any further treatment. But as there is small chance of rupture after taking methotrexate treatment, we advise the women to stay in the hospital if you are staying very away from the hospital, so that we can monitor. If you have rupture as indicated by severe pain or bleeding, we can take out to the operation theatre as soon as possible. Or if you are staying very close to the hospital, we advise you to stay alert. If you feel severe pain or bleeding, admit to the hospital immediately. Therefore, if you are having ectopic pregnancy, that does not mean you require operation. Even if you require operation, it may be done by laparoscopy, not by open operation. And in most cases, like when ectopic pregnancy has not ruptured, the size is small, the ultrasound suggests that we can do medical treatment, or beta HCG is low, we can do treatment with medicine, that is by giving methotrexate. Thank you for watching this video. If you have any further queries, please don't hesitate to contact us through our Facebook page or YouTube channel. Thank you very much.